Hi, good day. I'm Nelfrie and I would like to discuss with you a condition called Morton's neuroma. The clinical signs that you experience, that people usually present with, is they'll experience pain, that being the big toe over there. They'll experience pins and needles or burning sensation up their third and their fourth toe, also underneath in that area there. Or they will say that when they walk, they sometimes experience a sharp shooting pain coming from that area over there. Or it can feel like a hot coal, or sometimes what they experience is that they experience throbbing right in that area there. It can either be something that you would walk, or when you wear certain shoes that it will just all of a sudden flare up, or it could be a condition that you're aware of that constant ache and throb in that area there. So one of the diagnoses is Morton's neuroma. Obviously the only clinical way that you can confirm it is sending for an ultrasound scan. But often I see that if you present with all the typical symptoms, it is just obvious that it is a Morton's neuroma, and what we then prefer to do is to treat it conservatively, and if we find that with conservative treatment that we can't feel an improvement, then we send you for further investigations. But it also depends on how it presents clinically and when you do the examination. But obviously just going to discuss it, what you can do to offer you immediate relief, and obviously if the condition doesn't get improved, then obviously you need to seek medical advice. So I'm just going to turn the camera down to my sketch over here. Okay, so if you have a look, this is just an illustration of a foot. Big toe being there's your four toes. The black long lines illustrate your metatarsals, which are your 5 bones that's situated in your foot over there. And then the blue structures illustrate the nerves that run in between those metatarsals. It's a very basic illustration. Now, what happens with a Morton's neuroma? A Morton's neuroma only develops between the third and the fourth toe. If there's neuromas in other parts of the feet, it's called something else, or it's just called a neuroma. And the other thing is it's most common to develop a neuroma between the third and the fourth toe. So that's why it's got a specific name, obviously discovered by Mr. Morton, and it's in that area. So what happens, this here is a normal nerve. Your transverse arch runs across here. If you look at this skeleton here, that is your transverse arch running across here. You can see here's all the metatarsal bones. If you look at from the top, those are your long metatarsal bones, those are your toes, and there's your transverse arch running across there. So you have these nerves running in between these bones. Now, usually these bones are evenly spaced, but what happens is that often, either because structure, your arch drop, your transverse arch drop, or because of the way that you walk, or because of footwear, or just because of the anatomy of your bones, it causes these bones, and I'm just going to go to the picture, to actually move closer together. They move closer together like that, and then it causes friction on that nerve. And with the friction on that nerve, it causes that nerve to enlarge. So when that nerve's enlarged over there, it's known as a Morton's neuroma. So the Morton's neuroma develops in that area there. Depending on the size of the Morton's neuroma, how you can treat it. If the Morton's neuroma is relatively small to medium, which I don't know how to compare it to what, but if your Morton's neuroma is not big, then you can actually treat it conservatively and offer relief. So I always like to have a look at what's the cause of the problem. So there's various causes with Morton's neuroma, and it's very important to look at what the cause is and not just opt for have it surgically removed or to go for a injection in that area, because that don't always prove to be 100% successful in relieving the symptoms. So what happens is that the common causes for Morton's neuroma is if your transverse arch drop. So your transverse arch sits over the ball of the foot. It sits over that part of the foot over there, and what happens is that arch can drop. Now with that arch dropping, it causes these bones to move closer together, and with the bones moving closer together, it causes friction on that area there. If you're going to wear a shoe that's going to cause pressure on the sides, what's going to happen, it's going to squash the bones together, and that will cause more pressure on that area there, which will also cause that neuroma to get pinched. Every time you experience that sharp shooting pain is when that neuroma is getting pinched. If that neuroma gets irritated enough, what happens is it can get inflamed in that area, and that is usually when you sit with that throbbing pain where it becomes very painful. But another factor that can also influence the neuroma to be very painful is the way that you walk. So we were designed, and I'm not going to do the detail today, but we were designed to walk pushing through our big toe. So we need to start from our heel. This is where all the pressure should go through. So often what I find is that with a Morton's Neuroma is that you don't walk heel pushing through the big toe. You're actually pushing through the lesser toes. And as you're pushing through the lesser toes, it causes pressure in that area there. Now, this condition, I have neuromas that are confirmed by ultrasound scan in both my feet. So it's a very hands-on, I've got lots of hands-on practical experience, both through seeing patients and helping them, and also with my own feet. And what I've just found is that when it is so inflamed and painful, you actually want to sit and you want to move these toes up and down, and you also want to create space underneath that area there. It often helps to push underneath those bones just to create the space. Or what you do is where you get a tennis ball, which I will illustrate in one of my practical foot exercise sessions, where you basically just sit with your foot on a tennis ball and you allow the tennis ball to push into that area there, because as soon as it's going to push into that area there, it's going to cause the bones to create a bigger space there, which is going to take the pressure off the Morton's Neuroma. Personally, I find that with my neuromas, if I walk in a certain way, I've changed the way that I walk, that I always put the pressure through my big toe. That alleviates the pain. And then also there's certain shoes that forces me to push more through this part of my foot. And as soon as I wear those shoes, it brings on the Morton's Neuroma pain. And if I avoid those shoes, or when I'm wearing those shoes, I become very aware of pushing through my big toe, I can definitely see that there is an improvement. Just one thing to illustrate it here for you, just to show you. This is underneath your foot. So this is your first layer, which is your plantar fascia removed. And you can see all these muscles that the foot is made up out of. So there's quite a few layers inside, and then the Morton's Neuroma usually develop in between those two bones over there. If you have a look here over the top, it will be in that area there. But can you see it's not just the bone? There's actually 4 layers of muscle, and that's why it's often difficult to identify the Morton's Neuroma on an ultrasound scan and to get rid of the pain. So the best way is when you're at home and you can't get relief straight away is to try and push these bones up to create that space in that area, and that's the way that you get relief. And just be very careful with the shoes that you wear, and obviously if you wear a certain shoe that you find that makes it worse, that aggravates the condition, try and avoid wearing those shoes and then go from there. But on a later video, I'll show you practical, some very basic foot exercises that you can use, that you can do when you have Morton's Neuroma, and it definitely offers you relief. And often then you can treat it and get rid of it quite simply without major interventions. Thank you.